Well, good morning, everybody. Happy Monday morning. I hope everybody had a great weekend, and we're really excited to have you here. So we are at the 2023 Wisconsin Enrollment Conference pre-licensing sessions. So this is a smaller group before we go into our full conference later this week, which we're looking forward to having you there as well. So before we get started, I just wanted to both introduce myself, covering Wisconsin, as well as our staff member who is leading this session and the sessions for the next 2 days. I'm Allison Espeseth. I'm the director of Covering Wisconsin. If you're not familiar with Covering Wisconsin, we have been around since 2003, and we are the state's health insurance navigator agency. We are awarded funds from both federal and state sources that allow us to provide navigators all around the state. That's a total of 45 individuals who are navigators in the state, providing consumer assistance to folks in all 72 counties. We've been hosting this conference for 10 years. And we are so pleased to be working with the Wisconsin Office of the Commissioner of Insurance, as well as the Wisconsin Department of Health Services, whom you'll hear from today in their sessions, to be providing this content, especially the pre-licensing that is allowing you to join this community of enrollment assisters, which extends beyond the navigators. It's certified application counselors, as well as agents and brokers in the state. And if you're new to Covering Wisconsin, I just want to or even if you're familiar, I just want to make sure that you're aware of some of the resources that we can provide to you. They're available on our website, a lot of outreach and other resources, educational materials, which we call our how-to sheets, as well as a wealth of other things, promotional materials. They are there for you to use and to distribute in your community. And a few other logistical things also. So this year we're working. If you've been with us before, you'll see that this is a new platform. We are working with the Wisconsin Union Conference Management Services, which we're so pleased to be having their support. And they are handling the technical assistance and logistical aspects of this program, as well as this platform. So if you have any questions, if you need any help, they are going to be your resource. There is a live help in the top right corner of your screen that you can click on at any point if you just need that technical help. If you have questions, we totally and strongly encourage questions throughout this conference. That's really how we can make sure that we are answering your questions and helping to understand things that you might still be finding confusing or just need clarification on. During the session, there will be polling questions that will help to get some of that information, but there's also the Q&A function. The live chat is disabled, so the Q&A is really how you're going to be asking questions. And as you can probably tell already, your video and your mic are muted and disabled. So it's really through that Q&A function that's how you can help engage with this session. And last thing that I wanted to share is that at the end of the conference, so not just the pre-licensing sessions, but also the end of the main conference, there will be a post-conference opportunity. And we like to host these. It will be much less formal. It'll be interactive, probably a Zoom meeting. And this is just a Q&A. And it's open to anybody, both who is studying and preparing for pre-licensing and the exam, as well as those who have been with us for many years. It's a great opportunity to engage with some of our senior navigators who have a lot of experience, who can help you make sense of some of the content of the sessions. Again, some things that maybe were confusing at the time, and just a great interactive way to meet others in this community. So we'll be sharing more information about that, how to connect in the coming days. It'll be both on our website as well as in emails that we send to you. So again, thank you to our presenters today. And let me introduce you to Elizabeth Rothy. She is our affiliates liaison, and she is helping to lead this pre-licensing content. Elizabeth is new to us this year, so we're so thrilled to have her. She's doing a fantastic job, and I hope you'll give her a warm welcome. So I will hand it over to Elizabeth.
Good morning, everyone. As Allison said, my name is Elizabeth, and I will be moderating the pre-licensing sessions this week. We encourage engagement in our live polls, as Allison mentioned. That way we can learn more about your perspectives, experiences, and understanding. So please be sure to answer all poll questions as they come up. Due to the amount of content we're covering, we will not be answering questions live for the pre-licensing sessions. However, please put your questions in the Q&A. We will share answers out with slide decks on our website at the end of the conference on September 20th. Today, we have Nikki and Maciel from the Wisconsin Department of Health Services, and they will be presenting on the application for Wisconsin healthcare programs. Nikki is a policy analyst at the Wisconsin Department of Health Services. She currently works in the enrollment and outreach section, focusing on elderly, blind, and disabled, and long-term care customers. Prior to joining the enrollment and outreach section, she worked in the income maintenance training section, focused primarily on training EBD and LTC Medicaid to new income maintenance workers. She has worked at DHS since 2015. Prior to joining DHS, Nikki worked for Iowa County for 17 years, 11 of which she was an economic support specialist, working with families, elderly, blind, and disabled, and long-term care customers. Maciel is an enrollment and outreach coordinator. She works directly with community partner organizations who assist clients in enrolling and maintaining public benefits. Her role is to provide partner updates and communications and policy clarification, troubleshoot benefit or case issues, and collect stakeholder feedback to report trends to DHS leadership on policy processes and issues. With her 20 years of experience with Wisconsin Medicaid, Maciel has used her skill and familiarity with eligibility requirements to advocate for recipient rights for both the English and Spanish-speaking populations, identified systemic barriers, and collaborated with health partners, partner organizations, and the department to make sure needed improvements happen for Medicaid recipients. Maciel continues to be active in the community by attending several coalitions where she lends a keen partner-recipient perspective and develops strong partner relationships essential to continued efforts in providing optimal service for Wisconsin residents. Nikki and Maciel, please go ahead and start your presentation whenever you are ready.
Thank you, Elizabeth. Can everyone hear me? First of all, I just want to make sure. Actually, if Maciel wanted to just type in the thank you. Wonderful. Good morning, everybody. Welcome to session 1, applying for Wisconsin's healthcare programs. I'm so excited and happy to be here with you today. This session will end at 10:15 this morning, and then the next session will begin at 10:30. As Allison and Elizabeth both mentioned, questions can be entered in the Q&A box, and we will be addressing those at the end of the session as long as we have time, and we should have time. So as it was mentioned when I was being introduced, I've worked with Wisconsin's healthcare programs in one capacity or another for close to 24 years. I admit I still don't have all the answers. So my coworker Maciel is also here with your questions, but if there are any we can't answer between us or don't have time to Allison and Elizabeth so that they can follow up with you all later. Started. Today's agenda includes the purpose of this training, program basics, how to apply for Wisconsin's healthcare programs, what to expect after applying, outcomes, and finally, resources. So let's start with the purpose of this training, which is to provide navigators, certified application counselors or CACs, partners, agents, and brokers with a basic understanding about how to apply for Wisconsin's healthcare coverage programs and what to expect throughout the application process. There are 2 other sessions I'll be presenting this morning, eligibility rules for Badger Care Plus, and tomorrow I'll be presenting at 9. That session will focus on eligibility rules for Medicaid for elderly, blind, or disabled individuals. Before we get into the presentation, I want to mention that during the COVID-19 federal public health emergency, there were some temporary changes put in place for healthcare policy. We are in the process of unwinding these policies. Unwinding is the term our federal partners use to describe returning to routine medical operations after the COVID-19 public health emergency, or PHE. During the PHE, we maintained continuous coverage in which Badger Care Plus and Medicaid members remained eligible unless they passed away, moved out of state, or asked to be disenrolled. They were not required to complete redeterminations of their eligibility during this time. We temporarily suspended premiums, MAP work requirements, and a requirement for childless adults to answer a question about treatment needs for substance abuse. Our current status of unwinding is that new applicants who apply for Badger Care Plus or Medicaid on or after April 1st, 2023 do not have continuous coverage. For existing members, though, who enrolled prior to April 1st, 2023, we must maintain continuous coverage for them until a full redetermination of eligibility, which in most cases will occur at their next renewal. Renewals for those existing members for whom we must maintain continuous coverage were distributed evenly over a 12-month period from June 2023 through May 2024. Premiums and MAP work requirements won't be reinstated until January 1st, 2024. The information provided in the training today does not include these temporary. I may mention them during the presentation, so I wanted to make you aware of them and where we're at in the unwinding process. So let's move on to program basics. Badger Care Plus covers children ages 0 through 18, parents and caretaker relatives of children ages 0 through 18, pregnant people, and childless adults ages 19 through 64 who are not receiving Medicare except Medicare Part B immunosuppressive drug benefit, also known as Part B ID. More details on Badger Care Plus will be given in the Badger Care Plus eligibility rules session. Medicaid for the elderly, blind, or disabled, also known as EBD Medicaid, covers adults age 65 and older, individuals who are blind, and individuals who are disabled. And again, more details on EBD Medicaid will be given in the EBD Medicaid eligibility rules session. Most of Wisconsin's healthcare programs are administered by a network of county and tribal income maintenance, or IM agencies. IM agencies process applications, make eligibility decisions, issue benefits. All IM agencies use the CARES Worker Web eligibility system, also known as CWW, to administer benefits. All program rules are the same statewide, and applications are assigned based on where the applicant lives. Most county IM agencies are organized into 10 regional consortia, and you can find information on those consortia at the link shown on this slide. Milwaukee County IM is administered by the Wisconsin Department of Health Services, or DHS, through Milwaukee Enrollment Services, also known as MILES, and County IM is administered by the Menominee Indian Tribe of Wisconsin. When someone applies for healthcare coverage, the IM agency considers whether the person meets all the non-financial rules for healthcare programs. For example, is the person a U.S. citizen, or does the person have a qualifying immigration status? And what financial rules for healthcare programs? Does a 67-year-old applicant have assets below the EBD Medicaid asset limit? And then, based on the individual situation, which specific healthcare category is the most appropriate? For example, does the person qualify for Badger Care Plus or for a type of EBD Medicaid? When someone applies for a full benefit health coverage in Wisconsin, they don't have to specify which for. The CWW eligibility system will determine the best possible coverage for the applicant based on the program rules and the applicant's information. If someone is not eligible for Badger Care Plus or EBD Medicaid, but might be eligible to enroll in a qualified health plan or QHP at the marketplace, their application will be transferred automatically to the marketplace. Now that we've gone over some of the program basics, let's take a look at applying for Wisconsin's healthcare programs. In addition to healthcare, Badger Care Plus, and Medicaid, people can also apply for other programs in Access, including food share, family planning only services, caretaker supplement, Wisconsin Shares Child Care Subsidy, Wisconsin Works W-2, job access loans, and emergency assistance. People can also start a request for assistance for the Women, Infants, and Children, or WIC program. A person may use any of the methods shown on this slide to complete and submit an application, including applying online at access.wi.gov, applying in person or face-to-face, applying via phone, or applying by submitting a paper application. The filing date is the day a signed healthcare application is submitted to the IM agencies. In most cases, healthcare eligibility starts as of the first day of the month in which the application was filed. Applicants can also request up to 3 months of backdating for most healthcare programs. Although please note that some pregnant women who are immigrants or incarcerated in a correctional facility, such as jail or prison, qualify for backdated coverage. IM agencies have 30 days from when they receive the application to determine eligibility. Everyone applying for or receiving Badger Care Plus or Medicaid has the right to be treated with respect by IM agency staff, to have their civil rights upheld, to have their private information kept private, to get an application or have the application mailed on the same day it's asked for, to file an application right away, even if they're not in the correct office, and to get a decision about their application within 30 days of the day the agency receives it. Everyone applying for or receiving Badger Care Plus or Medicaid is responsible for providing accurate information, providing proof of information when requested, and reporting changes as required by the more information responsibilities. You can see the Enrollment and Benefits Handbook is available at the link shown on this slide. All right, that brings us to our first poll question. Question 1, which is not an allowable way to submit an application? A, completing an application by phone with an income maintenance worker. B, mailing in a paper application. C, completing an application online at access.wi.gov. D, completing an application through online chat with an income maintenance worker. Or E, meeting face-to-face with an income maintenance worker to answer the application questions. Which is not an allowable way to submit an application? We're going to give you a little time to answer that. Great, you guys. Looking at this poll, and it looks like most of you did answer D, which is correct. The correct answer is D. Access, unfortunately, does not have an online chat feature for people to communicate directly with an income maintenance worker. Applicants and members with questions can call their income maintenance agency or member services. Great job, everybody. All right, let's talk about the different methods of applying for healthcare. We'll start with Access, which allows members to apply for and manage their state of Wisconsin benefits and programs in one place at any time. The Access website is, as shown on this slide, access.wi.gov. Access connects members to the help they need when they need it. One of the Access functions, titled See if you can get help, is a short screening tool to find out which benefits you might be able to get. No Access login is needed for this tool. Another Access is Apply for Benefits, which allows applicants to apply online for healthcare coverage, food share, caretaker supplement, childcare, Wisconsin Works or W-2, emergency assistance or EA, which is different than emergency services for healthcare, ALs. Applicants can also complete a pre-application for Women, Infants, and Children Program, or WIC. This takes them outside of the Apply for Benefits module, and their pre-application information is sent to the WIC clinic in their area. In some cases, applicants may be able to get an immediate eligibility decision for healthcare. This is called real-time eligibility. An Access account also allows members to check benefits, renew benefits, pay ongoing premiums, manage their HMO, report changes, view notices, and perform other benefit management functions. To perform these benefit management functions, members need to create, authenticate, and use an Access account. As a note, members can also check their benefits and do some benefit management functions on the My Access mobile app. More information will be given about My Access later in this presentation. All languages are available in Spanish by clicking the Español link, and users are able to view help text for questions that may need additional explanation. The Access training site can be used to teach people how to use Access. This site cannot be used to apply for benefits. The web address for the training site is trn.access.wisconsin.gov. Walk-in and telephone applications are also ways in which applicants can apply for healthcare. Individuals have the option to apply in person at their county or tribal IM agency. They may also apply by phone. Each consortium has a central phone number for taking applications and other customer services. You can find phone numbers and office locations at the link shown on this slide. And the last method of applying for because they have different eligibility rules, Badger Care Plus and EBD Medicaid have different application forms. The Badger Care Plus mail-in application, Form F10182, is available at the first link shown on this slide, and the EBD Medicaid mail-in application, Form F10101, is available at the second link shown on this slide. However, either application can be used to make a request for full benefit health coverage. And that brings us to our next poll question. Question 2, which of the following actions can a person not do in Access? A, request a denial of benefit. B, checking benefit enrollment status. View electronic notices about their benefits. D, report changes to their household situation. Which of the following actions can a person not do in Access? And it looks like we've got most people responding. Awesome. Great job. It looks like the majority of you did choose A, which is the correct answer. Individuals cannot request a fair hearing to appeal a denial of via access. If an applicant requests a fair hearing in order to appeal a negative action taken on their application or case, they must submit their request to the Division of Hearings and Appeals. And we'll have more information on this later in the presentation as well. Great job, everybody. All right, that brings us to what to expect after filing an application. Let's start with some information about who will be processing those submitted applications. Applications submitted via Access may include programs that are not processed by income maintenance agency workers. Income maintenance agency workers process applications for healthcare, food share, caretaker supplement, and childcare. Programs processed by other agencies include Wisconsin Works or W-2, Emergency Assistance or EA, Job Access Loans, also known as JALs, and Women, Infants, and Children Program or WIC. Information in this presentation is specific to healthcare programs processed by income maintenance agency workers. Before making a decision about eligibility, IM agencies must verify the information the applicant has reported. In many cases, IM agencies can use data exchanges to verify the following information: citizenship, immigration status, earnings from a job, Wisconsin unemployment benefits, Social Security, supplemental security income or SSI, child support payments, and some liquid assets. In other cases, applicants will be asked to submit proof of what they have reported. Proof can be submitted by fax, mail, in person, or through Access or MyAccess. We encourage people to use Access and MyAccess if they can, because doing so submits the document to income maintenance right away, and MyAccess allows people to use their cell phone to take a picture of a paper document and submit it. No scanner is needed. The agency will send a verification checklist or VCL called a Notice of Proof Needed, listing the items that are needed and the date they're due by. A VCL will also be sent if the agency is missing information needed to make a decision and will include the date by which the agency needs the information. If an applicant does not provide the requested verification or information by the due date listed on the VCL, the application will be denied. So let's talk about that verification checklist or VCL. It lists verification requirements for Badger Care Plus or Medicaid, as well as caretaker supplement and food share if applicable. It provides the due dates for providing the information requested. It contains specific examples of documents that are needed. And it includes a document tracking sheet, which can be used to submit documents. The VCL, again called the Notice of Proof Needed, informs the applicant or member that the items we need proof of are listed with examples and instructions, and that failure to provide proof of the due date will result in benefits being denied, decreased, or ended. It also mentions using the document tracking sheet, which is located at the end of the notice, to make sure their benefits get processed as quickly as possible. Next, it lists the program or programs of assistance verification is needed for, along with the due date of the verification and the contact information for the consortium processing the application. Then the Proof Needed section displays, listing the proof that's needed, the name of the individual proof is needed for, examples of ways to give proof, which program or programs the proof is needed for, and the due date for submission. Now let's talk about possible outcomes of the application. After the IM agency has verified the information reported on the application, the agency will make a decision about the applicant will receive a letter telling them if the benefits are approved or denied. This is called a notice of decision. The notice of decision includes the following information: a summary. This section lists the benefits that have been approved and or denied, as well as contact information for the IM agency. Benefit details, including who's enrolled, dates enrolled, who is not enrolled, and if not enrolled, the reasons why. It also includes household income and deductions. These sections list the income and deductions on file for the household. Members should check to make sure that this information is correct. Additionally, it includes how we counted the income. This section lists the amounts and limits that were used to decide whether the member is eligible. Also, the notice of decision includes reporting rules. So if benefits have been approved, this section tells members what changes need to be reported to the local agency and when. It's very important to note that members must contact their IM agency or report changes in access. Changes reported to member services, which is the phone number on the Forward Health Card, or the HMO, are not shared with the IM agency. Finally, key contacts are listed. This section provides information about who members should contact with questions, and fair hearing information is given. The last page of the notice provides information about fair hearings, including the date by which a hearing must be requested and how to ask for a fair hearing. So, if benefits are denied, reduced, or ended, and the applicant or member believes the IM agency made a mistake, they can contact the IM agency directly to discuss the situation and try to find a resolution. If the applicant or member would like to request a fair hearing, they can ask the agency for help in requesting a fair hearing, or they can also directly contact the Division of Hearings and Appeals to request a fair hearing. At the end of the hearing, a hearing officer, or I'm sorry, at the hearing, a hearing officer will hear from the applicant or member and the agency to find out if the decision was right or wrong and require the agency to take action as appropriate. After the hearing officer will send a written decision to the individual and to the agency. And that brings us to our next poll question. Question 3. What is not included with the notice of decision? A, a list of who in the household is enrolled in benefits. B, the reporting rules stating what types of information the household must report to the Income Maintenance Agency within a certain time period. C, information about how to request a fair hearing. D, a list of the income and deductions used to determine eligibility. Or E, permanent forward health cards for a member eligible for Badger Care Plus or Medicaid. Again, which is not included with the notice of decision. All right. Looks like everyone has responded. Great job. Most of you did choose the correct answer, which is E, permanent plastic forward health cards are not included with the notice of decision. If a person is a new member, their forward health card will be mailed to them separately. New forward health cards will not automatically be mailed to people who previously were enrolled in Badger Care Plus or Medicaid. These members can use their old card if they still have it. And we'll talk about how they can get a new card in just a bit. I do just want to note, though, that individuals eligible for real-time eligibility, which we talked about briefly earlier, that's when someone meets the criteria for that immediate eligibility decision for healthcare through access. and individuals eligible for presumptive eligibility, which we'll be discussing more in the eligibility for Badger Care Plus session, those people may get their notice of decision and a temporary paper forward health care card online at the same time, but we don't provide permanent health cards with the. All right, let's talk about receiving services next. Each eligible person will receive a forward health card if they haven't received one in the past, should be shared with providers when services are requested. If someone has received a forward health card in the past, they will not get a new one. So members should be encouraged to keep their card in a safe place, even if they're no longer eligible for health care. Members can request a new card by either calling member services at 1 800 362 3002 or requesting one through their authenticated access account. Covered services are listed in the Enrollment and Benefits Handbook, which can be accessed at the link shown on this slide. Some services may require prior authorization. The provider will request authorization on the member's behalf. For some services, members may require to pay a copayment or copay. However, monthly premiums and copays for Badger Care Plus or Medicaid card services must not be more than 5% of their household income. This 5% cost share limit applies to members eligible for Badger Care Plus, SSI Medicaid, and most EBD Medicaid programs. Members enrolled in MAP and Senior Care do not have a cost sharing limit. This limit does not apply to deductibles, patient liability for institutional Medicaid, or cost sharing for home and community-based waiver services. For members subject to the cost sharing limit, a copay limit will be set on a monthly basis. The copay limit is based on the assistance group's income used to determine eligibility. Copays are tracked based on copays the individual has incurred, not the amount of copays members have actually paid out of pocket, since they may have incurred more than they've actually paid. For example, if the provider allows them to charge a copayment. Most copays range from 50 cents to $3. Providers may make a reasonable effort to collect the copay, but may not refuse services if the member does not pay. For questions about covered services and for help with finding a Badger Care Plus or Medicaid provider, individuals can contact member services at 1 800 362 3002. Now let's talk about renewals. Members must renew their eligibility every year. The renewal process can be completed online, by phone, in person. Members will receive a letter with instructions for completing the renewal approximately 45 days prior to the end of their 12-month certification period. In some cases, eligibility can be renewed through an administrative renewal. This occurs when the IM agency is able to verify all information through data exchanges. When eligibility can be renewed through an administrative renewal, the member does not need to take action to complete the renewal. However, members will be sent a summary of their case after a successful administrative renewal and are required to review it and report any changes to the agency within 30 days. As a reminder, these renewal policies are those under regular rules. Renewals were suspended during the COVID-19 public health emergency, but began again in June 2023. And that brings us to our last poll question. Question 4. Under regular rules, which of the following is false? And regular rules means when the COVID-19 public health emergency and temporary rules are not in effect. So which of the following is false? A, members will receive a letter with instructions for completing a renewal. B, members always need to submit a renewal form to their income maintenance agency as part of completing their renewal. C, the renewal process can be completed by phone, by mail, in person, or online. Or D, members must renew their eligibility every year. Again, which of the following is false during regular rules? Answer that. All right. Great job. It looks like most of you did select the correct answer. B is the false statement. Income maintenance agencies are able to renew eligibility administratively for some cases. This means that the member does not need to submit a renewal form if an administrative renewal was possible. They would just be required to review the summary sent to them and report any changes. All right, that brings us to some additional resources. Members with an authenticated Access account can download the My Access mobile app to do the following. Check their benefits to see the programs the member is enrolled in, including HMO contact information and when their next renewal is due. Members that have been issued a Forward Health or Senior Care card can also view those digital cards. They can get reminders of actions the member needs to take or the documents the member needs to submit. They can take photos of and submit proof at any time, then check its status in real time. And they can address, mailing it. My Access mobile app can be downloaded for free at the App Store or Google Play. Another resource for members is called A Guide to Applying, which is available at the link shown on this slide and includes information about who can enroll, how to apply, required verification, benefits and service, rights and program rules, and fair hearings. The Enrollment and Benefits Handbook, available at the link shown on this slide, is sent to all applicants and members and includes information about benefits and services available, program rules, required verification, change reporting requirements, covered services and prior authorizations, rights and program rules, and fair hearings. You can find information about IM agencies which determine eligibility for Badger Care Plus and Medicaid at the first link shown on this slide. And you can find information about aging and disability resource centers, which, among many other things, provides enrollment counseling for home and community-based waivers programs at the second link shown on this slide. Member services, whose staff can answer general member questions, information about covered services, and help with finding a local IM agency, can be contacted by calling 1-800-362-3002. And this is the same number that's on the Forward Health card. And a fair hearing can be requested through the Division of Hearings and Appeals. Their telephone number is 608 266 7709, and more information about the Division of Hearings and Appeals can be found at the link shown on this slide. Some resources for partners include information about Wisconsin's healthcare programs, including member fact sheets, which can be found at the first link shown on this slide. Information for partners in Southeast Wisconsin, which can be found at the second link shown on this slide. And partner demonstration videos can be accessed on the Wisconsin Medicaid and Food Share Partner Resources for Eligibility and Enrollment Vimeo site at the third link shown on this slide. And that does complete our presentation. We do have plenty of time to answer questions though, so we are going to go ahead and I am going to bring up the live Q&A. The first question is, what is the phone number to call and apply over the phone? That depends on which county and consortium the member lives in. So those links for the consortia telephone numbers would be where you would need to go to determine what the telephone number is for applying via phone. Is that, I just want to make sure that answers your question, Claudia. And then someone that may apply for Badger Care, will they also be assessed for other benefits they might qualify for, or do they need to ask to be assessed for the particular benefit as well? They need to ask to be assessed for any benefit they want to receive. So for healthcare, they're applying for any healthcare program that is available for them. But if they want to apply for food share, they have to request food share. If they want to apply for childcare, they have to request childcare, and so on. They won't be assessed for benefits that they have not applied for. Any other questions? We have plenty of time, so we're going to wait for a little bit. Is real-time eligibility the same as express enrollment we do here in the hospital?
I can take that.
Sounds good.
Okay, so Kim is asking about real-time eligibility, and that there is a little different than the average real-time applications that are done within the four walls of the hospital. So real-time eligibility is when someone does a regular access application and the system deems them eligible based on the income that they have. The applications that are done within the four walls of the hospital are actually called presumptive, is it PE? No, express
Yep.
enrollment presumptive eligibility for folks.
Yep, same thing.
And it does differ. One is actually an individual applying via access on behalf of themselves. We deem them eligible to the income that is given. And then also the express enrollment or the presumptive eligibility that's done in the hospital differs because that application is being done by someone from the hospital on behalf of a patient. I hope that's clear. Nikki, did that sound right to you?
Nope. Yep, that sounds great.
Excellent.
The next question is, what sort of information is available on a data exchange and what exactly is a data exchange? Great question, Wendy. So a data exchange is an exchange of information between Department of Health Services and, for example, the Social Security Administration. So a data exchange with the Social Security Administration by someone's Social Security, monthly Social Security payments. So it depends on which data exchange is running, what information is received, but that's what a data exchange is. Also through the Social Security Administration, we can get verification of someone's Social Security number. We can get verification of earned income through employment data exchanges that run. We can get verification of unemployment information through a data exchange with unemployment. Those are the types of data. There's many others, but those are the types of information. And like I said, depends on which data exchange is occurring, what information we're receiving. Yeah, absolutely, you bet. Any other questions?
Nikki, there was a comment in the section earlier just asking us to slow down a little bit. So maybe we can do that for
you
the
bet.
next section.
Thank you. Yes.
So much. Absolutely.
I apologize. I do have a problem with that. Please, if I'm going too fast, please let Maciel know and she'll kind of kick me in the butt and tell me to slow down. Sorry about that.
No worries. There's another question chat.
All right, let me go back over to the chat. Is there a website that provides in-depth, detailed information regarding eligibility for benefits for those with various immigration statuses? Maciel, do you know? I do not know of a website that provides that type of detailed information.
I believe this question would be better suited for the DHS Forward Health box that's here, that's on the presentation. Feel free to email that address, and we'll talk about that offline to be able to share whatever resources that we may have available for you, hon.
Thanks, Maciel. Appreciate that.
Absolutely.
Any other questions? I'm going to leave it open for a while because we've got plenty of time. All right. Doesn't look like we've got any other questions rolling in. Are these slides going to be available after the presentation? The slides were available before the presentation. They were sent out with your invite, I believe. So you should be able to download that to look through those slides and use the links on the slides. If you haven't already downloaded the Badger Care Plus one, I do recommend, since we do have a little extra time, especially making sure that you're at least downloading and have available to view the attachment that was sent with the Badger Care Plus presentation. That is a guide to determining the test group or something like that. I can't remember the exact name of it, but there was a one-page PDF that was sent along with the Badger Care Plus slide PDF, as well as the invitation for the Badger Care Plus session. You are going to want to make sure that you have that one-page PDF available to review, because you'll be using it as we walk through some examples of how to know how many people will be in a group for eligibility. Okay. Well, thank you, everybody. I think we were able to answer all your questions except that one, which Maciel asked to go ahead and send into the DHS Forward Health box. If you do have any questions about applying for healthcare that you think of afterwards, any new questions you might have related to applying for Wisconsin's healthcare programs, you can direct them to the Forward Health Partner inbox at the email address shown on this slide, dhsforwardhealthpartners@wisconsin.gov. I want to thank you guys all for your time and attention. Apologize for speaking too fast. I will try and slow down in the next session. And we are going to go ahead and take a break. The next session does begin at 10:30 this morning. So I will be back to present that one with you as well. Thank you so much.